Hello, how are you? How you day? Welcome to my live session, another session of Ask Doctor Fredostar. How far? Where are you watching me from? Now, today is what? Today is the 11th of June, 2024, and I'm live this evening to take some questions. So, in case you can hear me and you have questions for me, feel free to drop your questions here. Now, if you're watching this live session and we have ended, I'm sorry, I might not be able to respond to you. You understand? Yeah. Now I'm live on Facebook. I'm live on YouTube. I'm also live on TikTok. Blessing, Alpha now. Join me on Facebook now if you are less busy. Blessing, join me on Facebook now. Join me on Facebook. You don't say where I bring. I have Dr. Blessing in the house. Dr. Blessing, join me on Facebook now. Yeah, I'll send you the link now. Good evening, everybody. How are you? How you day? So let's answer some questions tonight. Yes, if you have questions for me, feel free to ask me your questions. Yeah, Rita, how are you? Rita, how you day? Good evening. Okay, so we did live on YouTube, we did live on Facebook, we did live on TikTok. Yeah, man. Okay. Welcome. So if you get any questions for me, feel free to ask me your questions because I noticed that a lot of people want to ask me questions, but I'm not always online. Now I'm online, I can take your questions. Okay. No problem, no problem. I understand then. I understand. Yeah. Okay. So, for those watching me on TikTok, for those watching me on YouTube, for those watching me on Facebook, wherever you're watching me from, if you have any question for me, please drop them in the comment section and I'll do my best to respond. Yeah. Stanley is watching me on YouTube as well. Stanley, good evening. How are you? I see you. Okay. Yes. Welcome. Let's see. Alex Ogua. Alex Ogua, your prodigal fan is on his way coming back. Mr. Alex, where have you been? Mr. Alex, long time. How is the family? How is Norway? How you day now? You don't tell. Juliet Richard, how far now? Join me on Facebook. Good evening. So I dropped a video few hours ago on gonorrhea. I dropped a video on Facebook on gonorrhea. How many of you have watched the video? Do you have any questions for me on gonorrhea? If you have any questions, please drop them. Oh yeah. Juliet Richard, how you day now? Good evening. How your side? How your side? How family? Okay. Fine. Thanks. Welcome. Now, for those who are not aware, there is a problem going on right now, and that has to do with resistant strains of sexually transmitted infections. A lot of people are coming down with resistant strains. So you notice most of the antibiotics are no longer working. Fine, thank you. Because um, a lot of people have abused antibiotics. So if you are listening to me right now, and for any reason you feel you have a bacterial infection, I want to appeal to you, please do not take any medication until a licensed medical professional has seen you, has assessed you, and prescribed the medication for you. This is very important because I once had a patient some time ago who had massive resistance. This patient had severe um, has had complications related to STIs. So I beg, in case you have a medical condition, this idea of I want to buy medicine, what medicine can I drink? Tell me the medication to buy to put you in problem more. You understand? Mr. Ima, how you there now? Okay, God bless you, Sarah. Okay. I beg you, for those that are just watching me for the first time, please, I don't do private chats. I don't do I don't do private chats on social media. So in case you're trying to send me a private message, I'm sorry, your private message will not get to me. Hmm? Uh-huh. My doctor, I really miss you. I lost my old Facebook account. Hey, yeah, sorry. Oh. Welcome back. How you doing now? How is the family? Okay. Mr. Ima on TikTok, how are you? Let's see. Do we have any questions for me? Is there any questions for me? Let's see. Yes, you can also subscribe to join my private Telegram. For anybody who wants to join my private Telegram, you can subscribe. There's a link on my page. Click on the link to subscribe and join in. Okay, let's see. Do I have any questions here? Which one says, my cute doctor, God bless you. God bless you. I'm good. I'm good. I'm okay. Welcome. Welcome. Okay. Now, I was talking about STIs, sexually transmitted infections. The funny thing is that there are a lot of people without symptoms. So if you are moving from one partner to another, if you are moving from one partner to another, you play away match, you increase your chances of coming down with STIs. Is that okay? Because you might not even know that your partner has this infection. Blessing, how you day? Or Gale? Um, Derek says, good to see you live here. Love your advice. I do really follow you. Derek, thank you. Thank you. How you day now? Tell me where you dey watch me from. So I beg for anybody where they watch me right now, and you get multiple partners. You know what I mean by multiple partners now? These multiple partners, two of you exchange body fluids together. You might be increasing your risk of coming down with an STI. So be careful. I will advise you to go get yourself screened. And if for any reason there is an infection, get treated. But the funny thing is that there are some infections that you cannot even treat. Example, there is no cure for herpes. So if you are the type, you engage in orals, you love to lick, you love to suck, you understand what I'm talking about? You might come down with herpes. Can I ask a question? Oh yeah, go ahead. Ask a question. Ask your questions. Somebody is asking me a question. Please, I want to ask you about my little son. He always runs temperature every month. Please, what am I doing wrong with his health? Whenever we go to hospital, it's either malaria or fever. So fever is not a disease. Let me clarify this. Thank you. I'm going to say a lot of things tonight. So if you are here with me, help me share this live session. I'm going to spend at least 1 hour tonight. Fever is not a sickness or a diagnosis. You heard me, right? So you have increased body temperature. That is not a sickness. That is not a diagnosis. It simply means that there is a problem going on. And I have made a video about fever. So let me just help you. Fever means there's an increased body temperature. Anything can make your body temperature go up. Anything can increase your body temperature. Bacterial infection, viral infection, fungal infection, parasitic infection, some medication, autoimmune condition, drug reactions, and a lot of things can make you develop fever. So if you notice you are having fever, it's for you to find out what's the cause of my problem. Now, your son is always having increased body temperature. If they are always telling your son or they're telling you that your son has fever, I think what you should do, try to ensure that he's not bitten by mosquitoes, most likely, by mosquitoes. Take the medications, use mosquito treated nets, insecticides, also use insecticide at home. Then I think he should be fine. Then give him balanced diet as well. Yes. Message you inbox. I'm sorry, my guy. I know they do inbox message. I don't do inbox with anybody. Sorry. Okay. Now I was talking about the people who engage in intercourse. Intercourse. Know what I mean by intercourse? What other word for intercourse? You dey knack. Especially those people will get multiple partners. Are you aware that if you knack anyhow, you feel carry infection? And this infection, some of them, no cure. Example, herpes. Herpes. Herpes that affects the mouth. You see people tell you that I have a blister at the side of my mouth. That is not malaria, that is herpes. And it has no cure. So you can get herpes type 1 under the blockers inside your pecus. You can have herpes type 2. And if you are not careful, you can develop blisters, sores, rash, pain around that area. So be careful. Is that okay? Mr. Ben and his wife are on my live session this night. How you doing now? Okay. Do you understand? And then for those people that like to suck, you love to suck, whether you are I don't want to go there, but you use your mouth to suck, you use your mouth to lick. It is important that you and your partner, you get tested. If the both of you are clean, if the both of you are free, and you want to lick, you want to suck, it's your life. Nobody will tell you not to suck. But if you know that you love to suck the whole community, anywhere you see microphone, you want to suck. Oh, baby, when you develop problem in your mouth, in your throat, your pharynx, and you now say, Dr. Fred, oh, please, oh, can you help me? Can I private chat you? I'm sorry, oh, no private chat, oh. You will pay for consultation, oh. You understand? So please, I beg you, be careful the places you suck and the guys that love to lick. Be careful, my dear, so that you don't carry problem with your mouth. Okay. You people are not sharing the live session. Let's see. Somebody says, please talk about heavy menstrual pain. How can I manage it? How can you manage heavy menstrual pain? So my advice to you is that if you are having severe menstrual pain, you have to find out why. It is abnormal for a woman to have severe menstrual pain. In some cases, when you are on your period, you might notice cramps. Cramps. This cramps is caused by certain chemicals that your body release when you are on your period. They are called prostaglandins. So they cause contractions of your uterus, and this gives you pain. But if you notice that whenever you are on your period, Faith, the pain is severe, unbearable, what you have to do is for you to go to the hospital, see your doctor. They will carry out 1 or 2 checks on you. They might do some tests as well to know what is happening. You understand? Then we can now manage, because there are some medical conditions that can actually give you severe menstrual pain. So if you are having severe menstrual pain, it is not normal. Now, I know that there are people listening to me for the very first time. Thank you for listening. Thank you for watching. You're welcome. Please, I beg, let's be on the same page. I don't private chat people. I don't private chat people on the internet. I'm here to teach you. I come online like this to answer you so that I can make up for the inbox. So I don't do private chat with anybody. I always encourage you, wherever you find yourself, do well to speak with your doctor, wherever you find yourself. But if for any reason you feel that you must speak with me, you really want to speak with me, okay, no problem. It's an honor to have that request from you. But the truth is that you would have to book for consultation. You will pay for the consultation, and then I'll make our time to speak with you. Is that okay? Yeah, thank you. Okay, I have a question on Facebook. If a man don't have sex since the time he was born and say he will get married before he begin to do, is it good or bad? Okay, Mr. Anderson, your question is not clear, but let me try to rephrase your question. Let me try to rephrase your question. So a man has never had sex before, right? And he's about getting married. So you want to know, is it bad if he doesn't have intercourse till he gets married? Abi, is that your question? Are we together? Is that what you are asking me? If that is what you are asking, okay. My guy, there is no problem. Oh. There is absolutely no problem with you if you don't engage in intercourse till you get married. Do you understand? There is what? No problem. Don't allow society pressurize you or make you feel that you are less of a man because you did not engage in intercourse. Some people have engaged in intercourse all their life before getting into marriage. No problem. But if you feel that you don't want to do it till you get married, whether you are a man or you are a woman, if you feel that you don't want to, you are not ready, fine, no problem. Yeah, man. Okay. So let me go to TikTok and take one question. How much is consultation? The link is on my page. If you click on the link on my page, you will see the amount. Is it good to drink water while eating? I heard it makes someone fat. So my question to you is, where did you hear that drinking water while eating makes you fat? You see, social media is filled with a lot of people. There are people on social media, they are jobless, so they just come on the internet to say nonsense. There are people on the internet, they're on the internet because they have some things to say. So I'm bothered. Where did you hear that drinking water makes you fat? What is the relationship between water and fat, my dear? Because if you will get fat, there are other things that would make you get fat. Number one is your lifestyle. Number two, what you eat. There is no relationship between water and fat. Do you understand? There is no relationship between water and fat. FAT. There is no. So, and I hear people say that should I drink water while eating or after eating? And they will tell you if you drink water immediately after eating, the water will react with the acid in your stomach and cause you problem. Therefore, you have to wait till 30 minutes after eating before you drink water. Some people will say, if you are eating, drink. My dear, if you don't drink water and you choke and you bite your way, the crave for I drink water whether after eating or during eating, and there is no bloody individual that will come and tell me that if you drink water immediately after eating, it will give you one problem, because they want to create attention on the internet, so they have to say something that will drive traffic. Drink water. Oh. If you choke, you bite your way. Your own and finish. You understand? Uh-huh. Okay, I have a question on Facebook. Good evening. What causes kidney problems that result in dialysis? Miracle on Facebook is asking me a question. What causes kidney problem? Maybe you are just following me. I made a detailed video. On the causes of kidney diseases. Detailed. It's on YouTube, it's on Facebook. There are plenty, but let me give you some. Uncontrolled hypertension, uncontrolled diabetes, certain medications, herbal concussions, agbo, bleaching cream. This can damage your kidneys, and many other stuff. You understand? So I'll encourage you, when you are less busy, go to my YouTube channel or go to my page on Facebook. You will see the videos there. Oh yeah, make una share now. Una know the gift for this TikTok. Now so una be, I be make I leave una for this TikTok. Ah, now wow. Una know they send gift for this TikTok. Eh? Hey, wait. Somebody's asking me a question on TikTok. Any home remedy for fibroid? My dear, no home remedy. No home remedy. No home remedy. Hmm? I have a question. They say I have high cholesterol. Can this be hereditary? I can really say I'm healthy. I eat right. All fruits that you really recommend, etc. Okay, you eat right and all the fruits I recommend. Yet my cholesterol is 297. What is your take on that? Okay, Mr. Derek. Now, the truth is that, yes, there is a part of cholesterol that can be hereditary. It's called familial hypercholesterolemia. Familial, is hereditary. There are people that have that condition because of genes. They inherit that stuff. However, look at me. I'm not I'm not big. But because I am not big, that does not mean I can't have high cholesterol. You understand? So you can also have high cholesterol even if you are not obese. Yes. This is why it's important you have a healthy lifestyle. You exercise, you eat healthy, exercise, and you eat healthy. Majorly, these are the two stuffs that helps you control cholesterol, because we have the good cholesterol and the bad cholesterol. So your value can be controlled. Just follow your doctor's advice. Yeah, man. Yeah. Somebody's asking me a question on YouTube. I'm live on Facebook and YouTube. It says, I always have this on and off severe pain in my right breast. I went for examination, but nothing was found. I'm just worried. Who did you see? Was it your doctor? Who did you see? Rita, who did you see? Tell me. Juliet. Ajay Juliet, how are you? Ajay Juliet, how are you day? Okay. I missed my period for 1 week now, and my test came out negative. Hey, relax now. Calm down. Calm down. If you're planning to get pregnant, you repeat your pregnancy test. Sometimes you might be doing this test too early. So relax, I beg. Let's see. You guys on this TikTok now. What for now? Now, wow. Let me see. Let me see. What is the difference between cholesterol and iron deficiency? You can read that on Google, Queen. Queen, you can read that on Google. Somebody says, thank you for your lecture. My wife has taken in now, just last month. You gave us expo on ovulation. Really? Thank God, though. Congratulations to you. Honestly, I can't remember, but congratulations to you and your wife. I wish you a wonderful pregnancy journey. Yeah, congratulations. Let's see. Let's see. Is it safe for ulcer patient to eat plantain? Is this safe for ulcer patients to eat plantain? Let's see. Okay, so this is my answer to you. If you have ulcer and you know that whenever you eat plantain, fried plantain, you develop heartburn, we advise you to avoid it. There, the kind of food to avoid if you have ulcer is not resolute. There are certain foods that, if you have ulcer, we encourage you to avoid because they can trigger or worsen your ulcer. Things like caffeine, things like alcohol, things like smoking, things like spicy food, things like peppery food, um, certain fruits for some people. If you have ulcer, some people with ulcers can't take oranges, some can't take pineapple, some can't take watermelon, some can't take guava, some some can't even take Gary. They can't drink Gary. So it depends on you, Prince Justice. Do you understand? I went to the hospital and saw the doctor. Okay, so relax, eh? No panic, no panic. Yeah, relax. Now, again, let me say this. I keep getting over or more than 100 messages in my inbox every day. I beg, no vex. I beg, no vex. I know they private chats on social media, and I have my reasons for that. I beg, no vex. I dey apologize. In case you dey send me private message, no vex. I know they do am. I beg. I have my very personal reasons and very professional reasons for that. So in case you dey here and you send me private message, I no go open am o. No vex, yeah? Yeah. Okay. Bolanle, how are you? Let's see. Uchechi, how are you? How are you? How you day? How you day? How you day? How you day? Thank you. You're welcome. Let's see. Can I DM you directly on TikTok? No, ma. You can't DM me. I'm sorry. I'm sorry, my guy. Huh? How can someone reach out to you, please? You would have to pay for my private time. You would have to pay for consultation. No vex. Yeah? No vex. I know they do that one here. Um, Taking of coffee. Is it healthy? Is it good? Taking of coffee. Okay. So I think early this year or last year, I think I made a post on coffee. I made a video on coffee. But before I made that video, I did a lot of research, something like a systematic review. Now, what I found out was that there are certain amount of coffee that might be beneficial for some people. There is a certain amount of coffee that can be beneficial to some people. Do you understand? So, coffee has, in quotes, some benefit for some people, but there are some other group of people that coffee can be bad, especially those people who need to take coffee to work, the people who can't function without taking coffee. Hmm? These are the people that coffee can affect, because in coffee you have what we call caffeine. Now, you shouldn't take more than 200 milligrams of caffeine in a day, 200 milligrams. But there are certain people that even 200 milligrams can be too much for them. So, if you are taking coffee to stay awake, to perform, and the rest, you might suffer some consequences. Example, you can have palpitations. You can develop palpitations. You can develop insomnia. That is, sorry for my grammar. I'm sorry. So palpitations means that your heart is beating very fast. Insomnia means that you find it difficult to sleep. Do you understand? And other stuffs. Yep. Good evening, Glory. Good evening, Glory. How far? How are you? How are you? Let's see. I'm doing great. Can also cause, let me see, can also cause chest burn. So the answer is yes, and the answer is no. Yes, ulcer causes chest burn. No, because there are other conditions that can also give you chest burn or heartburn, and yet not ulcer. Because if I tell you that you have heartburn and because of that is ulcer, your condition might not be peptic ulcer disease. Your condition might be maybe gastritis or reflux disease or pancreatitis or even gallstone. So we are careful saying that yes, so if you have heartburn, it's ulcer. Because there are other conditions that can also cause ulcer. Yes. Charity, how are you? How are you, Charity? Long time. Okay, somebody says, how can one pay for your consultation? And Don Mekus. Okay, let me say this. For anybody who wants to have a private consultation with me, there is a link on my page. There's a link on TikTok. If you click on this profile, you will see one link. Click on the link. You will see book consultation. You understand? If you're watching me on YouTube or Facebook, look at the description of this live video. You will see a link to book consultation. Now, the reason I'm saying this is because I'm sorry, oh, I don't get free time to give people no vex. Yeah, that is why. It's not as if I don't know that you need help, but I don't have that free time. Yeah. Good evening. Been following you for a while now, and I'm so glad I did. Margaret, thank you for following. God bless you. God bless you. God bless you. Malaika, Lovelina, how are you? People for TikTok, una know they send gift oh. Now that one they fear me for una for this TikTok. Una know they send gift oh. Ah. Okay oh. Hi, my baby. Hello. How are you, love? How you day, rejoice? Let's see. Please, I just put to bed 3 months ago through cesarean section, and I've been having constipation. Constipation since when? Since when? I'm live on Facebook, I'm live on TikTok, I'm live on YouTube. And I have about 20 more minutes and I'm done. Yeah, man. Okay, let's see. Let's see. How many more comments do I have? I have been sporting for what? You have been sporting for 2 weeks now. Please, what could be the cause? Sophia says she has been sporting for 2 weeks. Oh, baby, fine girl, madam, there is no way we can know what is making you sport for 2 weeks on TikTok. There is no way, honestly. Because if you have been sporting for 2 weeks, we have to find out a lot of things about you. We need to find out your age, your menarche, your menstrual cycle, find out your drug history, a lot of things to know why you are sporting for 2 weeks, because it is abnormal for a woman to sport. But if you are on family planning, let me just dash you that one here. If you're on family planning, that might be the reason. But if you are not on family planning, I beg, stay your doctor, yeah? I beg, I beg, I beg, I beg, I beg, I beg. What causes blood in the poo poo? Osalo wow. Oh God. If you get blood for poo poo, if you notice that when you go to toilet, you see blood, my guy, this is something that needs to be investigated, my guy. Because um I'm trying not to say something that will make you panic. You understand? But seeing blood in your poo is not something we joke with. It can be mild though. It can be tear. Some people can have strong, hard poo poo. Your poo poo can be very hard, hard like stone. It can tear you for that place. You might see little blood. You might have an issue with that inner region. Blood might come out. You might have a problem up inside your colon. Blood might come out. So if you see blood inside your poo poo, and the best advice is to see doctor. Abeg, 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 abeg. Honestly, honestly, it's not as if they help you, but these are not things we can joke with, huh? So that somebody will not tell you that the thing is no, there's no problem, but indeed there's a problem. I'm confused. Why are you confused? Why are you confused? Why are you confused? Sisi, how far now? Thank you. You're welcome. Um, I've been having stiffness on my fingers for some years now. Your fingers are stiff. I have about 15 more minutes. Your fingers are stiff. Why should your fingers be stiff? Joint problems, occupational problem, age related. God go bless you. Thank you for the gift. Oh, God go bless you. Out of the people where they look me for here, now you and somebody else, you and who give me gift. Glory, Sama, Gentleman, Morpheus. Now when they send me gift, God go bless you. You go born twins. Another woman who will carry your husband. Another man who will carry your wife. Say amen. Oh yeah, claim it. I say receive. Oh yeah, say amen. 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 Yes. That's so. Okay. Um, so if you are having stiff fingers, it might be your age, it might be the work you do, it might be metabolic, or it might be what again now? Is it nutritional? It might not be nutritional. So what can I advise you now? Stiff fingers, yes, done long ago. What have you done? So tell me, yes, you're on Facebook. Margaret, please tell me, what have you done since you noticed stiff fingers? Yeah, talk to me, talk to me, talk to me, talk to me. Yes, so yes, thank you, thank you, thank you for the gift. Yes, glory, claim it, claim it, claim it. Thank you for the gift. How we go plenty for here? Now only 4 people they give me gifts. What happen? I be now want make I come they talk about nyash. Nyash, nyash. Is that what you want? Is that what you want? Because now that kind of thing in the rain now. So if that's what you want, let's know. Okay, let's take some questions. Let's see. What is the cause of left leg pain when walking from the lap down? It might be from your back, from your spine. It might be from your waist. If you are having pains that affects your whole leg, I'm going to post a video tomorrow on back pain. Yes. Ladies and gentlemen, I'm going to post a video on back pain. This video is hard. It had me to edit. It had me to edit. The video is about 20 minutes. Back pain is big. So I'm going to post the video tomorrow on YouTube and Facebook. I'm not going to post the video on TikTok. You hear me? So I'm going to post it on YouTube and Facebook on back pain. So I beg, when I post the video, make una help me share more. Thank you. Yes. So it might be from your waist, my guy. It might be from your waist. It might be from the job you do or from your age. So we now advise you try to massage in quotes. But if the pain is very severe, you might need to do some tests. You might need to do an X-ray. You might need to do maybe an MRI or a CT scan, as the case may be. Yeah. So you understand? Yes, yeah. Okay. Okay. For anybody that wants to join my private Telegram, I just remembered. For those on Facebook, for those on YouTube, and those on TikTok, if you want to join my private Telegram, there is a link on my page. Click on the link to subscribe and join my private Telegram. It's not free, I beg. It's very cheap. Very cheap. When you join, today is what? Today is Tuesday. Tomorrow is Wednesday. Okay, yes, we have a live session tomorrow, private live session. So you can subscribe. Click on the link on my page, subscribe and join. Everybody, whether you're on YouTube, you're on Facebook, you're on TikTok, subscribe and join. That way I can interact with you more. Okay, what should I do to reduce high cholesterol? So depending on the value of your cholesterol, exercise, eat healthy oils. There are some healthy oils, cooking oil. There are some healthy cooking oil, like the olive oil and some of them, very healthy oils. Avoid junk food. Eat vegetables, eat fruits. This should help you. This should help you. I have 10 more minutes. I have 10 more minutes. The doctor prescribed Dolo something. You've forgotten the full name, but it didn't work. Okay, so I think you should go back. You should go back. I know the name. I know the name. Dolometa B, right? Yeah. I think you should go back so that they should check you again. If you see a doctor and the doctor prescribes a medication for you, and you feel that there was no relief at all, I think what you should do is for you to go back and see the doctor. Huh? Sure you get so that they can review your complaints, review the medications, and change. Yes. And then you can also discuss with your doctor. Maybe they can do some investigations for you. Hmm? Maybe they can do some investigations for you. For your joint. Yep. Yep. Okay, I don't retire and I'm preparing to shut down. I don't retire. I don't retire. Like I don't retire. So I have to go. Who sent gifts? Oh, Glory send us coins. Thank you, Glory. Thank you. Thank you. Let's see. I have to go very soon. My time on the live session is almost up. Is almost up. Okay, what's it? Please what? Please what? Please what? Olabisi from Oyo. Please what? What's your name on Facebook? Doctor Fredostar official. So when you go to Facebook, take out your time. My page has 360,000 followers. Before you click on the follow button, look at the page you are following so that you don't follow a fake page. There are some fake pages on Facebook that are not my page. But if you're not careful, you think I'm the one. They are thieves. So go to Facebook, search for Dr. Fredostar official. Look at the number of followers, 360,000. Then you can follow me. Yep. Somebody says what's please, what's the cause of fungal infection and remedy? Fungal infection is caused by fungus now, a fungi. Ima, who tell you say you get fungal infection? Uh, Fungal infection is caused by fungi. Fungi. Now they cause them. What happened to your eyes? I don't know. Are my eyes okay? So fungal infection is caused by fungi. How do you manage fungal infection? By confirming your diagnosis and taking antifungal agents. But the thing is that some people have abused medications without even speaking with their doctor. So they just wake up, go to the lab, carry out one or two tests, and start taking medication. And because of that, they have developed resistance. They develop resistance, and it's now difficult to manage. So if you have a fungal infection, I think that you should confirm that diagnosis with your doctor, and then your doctor will prescribe an antifungal agent for you. It is not right for you to just wake up and go take medications because you feel like I have a fungal infection. No. Number two, it is not right for you to just wake up, go to the lab, and test yourself without speaking with your doctor. So if you have a fungal infection, you would most likely take antifungal agents. But the truth is that I don't even know if what you have is a fungal infection. Ima? Yep. Okay. I think I have to go now. Yes, I don't try. I don't try. Any likely side effects of taking vitamin C supplements that form what every day? So give your body a break. if you abuse vitamin C, if you abuse vitamin C, you can develop some side effects. Yeah, you can develop side effects. Yes. If you abuse vitamin C, you can develop side effects. So, yeah. I will send you a message in your DM. My guy, no DM, my guy. No DM, no vex. Yeah? No DM. No vex. I know they do DM with anybody. Okay. So, be careful with the supplements you take. There are very good supplements out there, but if you abuse them, they can cause you problems. I beg, as I round up, I beg you, please speak with your doctor. I don't try. I don't tire. Follow me on Facebook and YouTube so that you can benefit from my videos. Tomorrow, I'm going to post a video on back pain. Yeah, tomorrow. And please share the video. Yeah, man. Yeah, man. Yeah, man. And finally, I know they do private chats. So if you send me a private message, I no go read them. I no go open them. I no go check them. No vex. And if you want to join my Telegram, you can subscribe as well. Subscribe to my Telegram so that when I go live on Telegram, we can speak on the live session. If you want to speak with me during my live session, you can join me on Telegram. So look for the link on my page, subscribe there, and when we go live and you have questions, what time tomorrow? No, I'm not coming online tomorrow. I'm going to be on Telegram tomorrow. My people on Telegram need me as well. Those ones are special people. So we're going to be discussing tomorrow on Telegram. So if you want to join us, click on the link, subscribe, and when we go live there, I can take your questions. Time on Telegram. The time is private now, bro. The time is private. It's not public. It's private. It's a private group, not public group. And you can only join when you subscribe. So take care and have a wonderful night. Bye bye. People on Facebook and YouTube, thank you so much. God bless you for joining. I'll see you later and have a wonderful evening. Remember, good life. Good life, in a sense. Au revoir.